Good day, dear students. I am Chmidon Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University, and today I will talk about muscles, the questions of particular myology, and we will talk about muscles of upper and lower limbs. First, I want to tell that the hand, as an organ of labor, performs certain necessary movements with the help of the muscles of the upper limb. The musculature of the shoulder girdle attach it to the skeleton of the trunk, thus forming muscular joining of bones, synsarcosis, from Greek language sarkos, which means muscle, and moves the bones of the girdle, mainly the scapula and the whole upper limbs. The muscles of the shoulder girdle run from the head, back, chest, toward the bones like to a center from all directions. So the muscles of the shoulder joint develop in accordance with the spherical shape of the shoulder joint and the performance of multi-directional movements at the joint. Its muscles are attached to the humerus, are arranged on all sides. They are divided topographically into dorsal and ventral group. So let's start about dorsal group. The deltoid muscle. You may see this muscle in red on this picture. Musculus deltoidus, it's in Latin, covers the proximal end of the humerus. It's triangular shape and arises from the lateral 1/3 of the clavicle and the coronal process of the scapula and from the entire length of the spinal scapula. The anterior and posterior slips of this muscle pass almost straight downward and laterally. The middle slips curve over the humeral head and pass straight downward. Other slips converge and attach to the deltoid tuberosity in the middle of the humerus. Contraction of the anterior or clavicular part of the deltoid muscle raises the arm forward. This causes antiflexia. Contraction of the posterior scapular part causes the opposite movement, retroflexia or extensor. Contraction of either the middle acromial part or the whole deltoid muscle abducts the arm from the trunk to the horizontal level. All these movements occur at the shoulder joint. When movements at the joint are restrained by the abutment of the humerus against the vault of the shoulder, the arm can be raised above the horizontal level. Elevation with the help of the muscles of the shoulder girdle and the muscles of the back, which are attached to the scapula. In this case, the superior slips of the trapezius muscle, when we studied this muscle in the lecture about body muscles, pull the lateral angle of the scapula upward and medially by means of the spinal scapula, while the inferior slips of the anterior serratus muscle pull the inferior angle upward and laterally. As a result, the scapula rotates the sagittal axis, passing through its superior angle. This angle is studied by connecting the scapula in the raising of the arm above the horizontal position. And also you may see the trapezius muscle, and also you may see the part of serratus anterior muscle. And I repeat that we learn these muscles in the lecture about body muscles. Traction of the rhomboid, you may see these rhomboid back muscles on this picture, and anterior serratus muscles, and the levator muscle of the scapula, you also may see this body muscle. When the scapula rotates, its glenoid cavity is lifted with the humerus, which is held in its former position in relation to the vault of the shoulder by contraction of deltoid and the supraspinatus muscle. So next we'll talk about supraspinosus and infraspinosus muscle. You may see these muscles on this picture, and supraspinatus muscle you may see in red. This muscle, in the Latin, is musculus supraspinatus, lies in the supraspinous fossa of the scapula. Arises from this fossa, passes under the coracocameral ligament, and attached to the upper part of the greater tubercle of the humerus. You may touch this tubercle in yourself. This muscle is covered by a strong fascia supraspinata, which fuses with the edge of the supraspinous fossa to form a sheath for this muscle. Action: abduction the arm, and this muscle is synergist for deltoid muscle. Next we'll talk about infraspinatus muscle. You may see this muscle in red on this picture. Musculus infraspinatus, it's in Latin, occupies most of the infraspinous fossa of scapula, arises from this fossa and from the infraspinous fascia, and it attached to the greater tubercle of the humerus. Function or action: rotates the humerus laterally. Rotation. Laterally called supination. You must know this. So next we'll talk about teres muscles, and first we'll talk about teres minor muscle. You may see this muscle in pink color on this picture. The teres muscle, it's Latin musculus teres minor, arises from the margin lateralis of the scapula and attached to the greater tubercle of the humerus below the tendon of infraspinosus muscle. Action: rotation to the lateral side or supination. So the unspinatus muscle, together with the teres minor muscle, is covered by strong infraspinous fascia, which is fused with the spine and borders of the scapula and invests these muscles in an osteofibrous sheath. So next we'll talk about teres major muscle. You may see in red color. The teres major muscle, musculus teres major, it's in Latin, arises from the posterior surface of the inferior scapular angle. You may see the angle scapular here, and passes on the lateral border of the scapula through the crista tuberculi minoris. You may see this crest on this picture in humerus, and it attached to this place, together with the latissimus dorsi muscle. In men, this muscle is isolated from the subscapular muscle, but retains common innervation. Action: pulls the arm to the back and downward, and thus adducts it, and also rotates the arm medially, or pronate the arm. So next we'll talk about ventral group, but first we talk about subscapularis muscle. Why ventral? Because this muscle occupies the entire costal surface of the scapula. The wide and flayed tendon of the muscle passes laterally in front of the shoulder joint and attached to the tuberculum minus or tuberculum minus of the humerus. Between the tendon and the articular capsule is lodged the bursa subscapularis, described later. I'll show you this bursa later. So this subscapular muscle is covered by the subscapular fascia, which attach to the margins of the subscapular fossa. The actions rotates the arm medially and can also pull the joint capsule tight and thus prevent it from incarceration. The muscles described above, which are attached to the greater tubercle of the humerus, also possess this last property because they are fused with the capsule. So I show you well-known latissimus dorsi muscle, which also attached to the crista tuberculi minores. So on this picture you may see the additional apparatus of muscles. You may see bursas, and also you can see subdeltoid bursa. We talked about them, these bursa. Also you may see coracobrachial bursa, and also you can see the subscapular bursa. Subscapular bursa. You may see subtendinous bursa of latissimus dorsi and teres major bursas. You may see these bursas here. So next we will talk about muscles of the upper arm. And the muscles of the upper arm retain the extremely simple form characteristic of the initial arrangement of the limb musculature and are traditionally divided in two flexors, muscle biceps and muscle brachialis on anterior surface, and two extensor, muscle triceps and muscle anconeus of the posterior surface. These muscles are concerned with the movements at the elbow joint on the frontal axis and are situated on the anterior and posterior surfaces of the upper arm and attached to the bones of the forearm. The two groups of muscles are separated by two connective tissue septa intermuscular branchiae, passing to the lateral and medial borders of the humerus from the brachial fascia, which invest all the muscles of the arm. These septa are particularly developed on the distal end of the humerus at epicondyle. But if we talk about two muscles of anterior group, biceps muscle and brachial muscles, I also want to tell you that this is third coracobrachial muscle. And all these muscles will flex the shoulder joint, but only two muscles, biceps and brachial, will flex elbow joint. First, you may see the coracobrachial muscle on the left picture in blue color. Arise from coracoid process of the scapula along with the short head of the biceps. You also may see the short head of the biceps, and attached by short tendon to the medial surface of the humerus, distal from crista tuberculi minoris. So this muscle flex forward, elevates forward, and adducts the arm. Next, we'll talk about biceps brachii muscles. Musculus biceps brachii in Latin is a large muscle that it's clearly visible under the skin when contracted. Therefore recognized even to people unfamiliar with the study of anatomy. You may see this muscle in gray. Proximally, the muscle consists of two heads. One long head, caput longum, arises from the supraglenoid tubercle of the scapula by a long tendon which passes through the cavity of the shoulder joint and then occupies the intertubercular groove of the humerus where it's surrounded by the vagina synovialis intertubercularis. So you may see this tendon on this picture, and also you may see vagina synovialis intertubercularis here. This is the tendon of long head. So both heads unite and form an oblong spindle-shaped belly which terminates as a tendon attached to the tuberosity of the radius. A synovial bursa bicipita radialis, is always found between the tendon and the tuberosity. This tendon gives rise to a flat extension aponeurosis of musculi biceps brachii, which passes medially and interlaces with the fascia of the forearm. Action. Flexes the forearm at the elbow joint because it attached to the radius bone. It also acts as spinator when the forearm has been pronated. The biceps muscle passes not only over the elbow but also over the shoulder joint and can act on it and flex the arm if the elbow joint is held fast by a contraction of the triceps muscle. The brachial muscle, musculus brachialis, you may see this muscle in blue on the right picture, lies deeper than the biceps muscle and arises from the anterior surface of the humerus between the deltoid tuberosity and the capsule of the elbow joint, and from both septa intermusculari brachii. The muscle then distends in front of the elbow joint and covers it and attached to the tuberosities of ulna. Action. The brachial muscle is a pure flexor of elbow. Next, we will talk about posterior muscles of upper arm. The triceps muscle. You may see this muscle on the picture, on the left picture. Musculus triceps brachii, it's in Latin, occupy the entire posterior surface of the upper arm and consist of three heads, which meet to form a single common tendon. You may see this tendon on this picture. The long head, caput longum, it's in Latin, arises from the infraglenoid tubercle of the scapula and then distends between the teres major and teres minor muscles. The lateral head, caput lateralis, Latin, arises from the posterior surface of the humerus above the laterally of the sulcus nervi radialis, and lower from the septum intermusculari brachii laterali. The medial head, you also may see the lateral head of this picture, and also we see the long head. So the medial head, caput mediale, arises from the posterior surface of the humerus distally of the sulcus of the radial nerve and from the both intermuscular septa. The white common tendon is attached to the olecranon of the ulna. Behind the tendon, between it and the skin, in the region of the olecranon, is a synovial bursa olecrani, it's in Latin. The action extends the forearm at the elbow joint, and also it extends the shoulder joint too. The ancaneus muscle, you may see on the right picture in red, musculus ancaneus, it's in Latin, is small and triangular. Its proximal border adjoins the triceps muscle, arising from the lateral epicondyle of the humerus and the collateral radial ligament of the elbow joint. It's attached by its wide base or to the proximal one, first of the posterior surface of ulna. Action extends the forearm on the elbow joint. So next we'll talk about forearm muscles. There are many forearm muscles. The flexor and extensor are classified according to action, some flexing to extending the wrist, some only the fingers. One of the extensor abducts the thumb. In addition, there are pronators, supinator, which accomplish the corresponding movements of the radius. These muscles are separated in two groups according to position. The anterior group is composed of flexors and pronators, the posterior group of extensor and supinators. Each group consists of the superficial and deep layer. The superficial layer of the anterior group of muscle arises from the medial epicondyle of humerus. You may see the medial epicondyles here. The similar layer of the posterior group from the lateral epicondyle. The deep layer of both groups has no place for attachment to the epicondyles and so originates of the bones of the forearm and on the interosseous membrane. The terminal insertion of the flexors and extensors of the wrist are on the basis of the metacarpal bones. Muscles stretching to the fingers are inserted into the phalanges, with the exception of the long abductor muscle of the thumb, which is inserted into the first metacarpal bone. The pronators and supinators are inserted on the radius. The forearm muscles near the upper arm consist of fleshy parts, whereas toward the hand they become long tendons. As a result, the forearm is shaped like a cone, flattened anterior-posteriorly. So let's talk first about anterior group. The superficial layer is formed of the following muscles. Pronator teres muscle. You may see, and I point this muscle on this picture. The pronator teres muscle, musculus pronator teres it's in Latin, arises from the medial epicondyle of the humerus, the medial intermuscular septum, and the tuberosity of the ulna. It distends obliquely and laterally and attached to the lateral surface of the ulna directly above its middle part. Musculus flexor carpi ulnaris. Its next muscle, flexor carpi ulnaris muscle, you may read, is inserted into the pisiform bone, but this bone may be considered as a sesamoid bone invested in the tendon of the flexor carpi ulnaris that reach the fifth metacarpal bone. So you must remember about sesamoid bones. So the flexor carpi ulnaris is one of the ulnar border of the forearm. You may see this bone or this muscle on the picture, this one. It originates from the medial epicondyle of the humerus, from the posterior margin of the ulna, and from the olecranon. Its tendon is attached to the pisiform bone, as I told you, which is a sesamoid bone, in relation to it and then to the hamate bone as ligament pisi-hamatum, and to the fifth metacarpal bone as ligament pisa-metacarpale. So next we'll talk about flexor carpi radialis bone or muscle. You may see this muscle here. This muscle, musculus flexor carpi radialis, it's in Latin, is a fusiform bipinnate muscle lying on the medial border of the pronator teres muscle. It arises from the medial epicondyle of the humerus and attached to the base of the second metacarpal bone. Action. Um, this action flexion of the wrist and can also abduct the hand radially in the combination with extensor muscles. Next, we'll talk about palmaris longus muscle. You may read this name. So, palmaris longus muscle, musculus palmaris longus, run medial to flexor carpi radialis and arises from the medial epicondyle of the humerus. Its short fusiform belly ends very high in a thin, long tendon which passes over the retinaculum flexorum and blends with the palmar aponeurosis. This muscle is often absent. The action tenses of the palmar aponeurosis and accomplishes palmar flexion of the wrist. The flexor digitorum muscle, musculus flexor digitorum superficialis, it's in Latin, lies deeper than these four muscles. It arises from the middle epicondyle of the humerus, the coronoid process of the ulna, and the upper part of the radius. The muscle separates into four long tendons which distend from the forearm to the palm through the canalia carpalis and then pass to the index, middle, ring, and little fingers. At the level of the body of the proximal phalanx, each tendon splits in two parts which separate to form a gap called the hiatus tendinous. The tendon of the deep flexor passes through the gap and crosses the other tendons, which then attach to the palmar surface of the bases of middle phalanx. The action flexes the proximal and middle phalanx of the fingers, except for the thumb and the wrist. So you may see this muscle on this picture. This is a flexor digitorum superficial muscle. Next, we'll talk about a flexor pollicis muscle. This muscle arises from the anterior surface of the radius, distally to the radial tuberosity, and often from the middle epicondyle of the humerus. Its long tendon passes under the retinaculum flexorum onto palm and in the groove between two heads of the musculus flexor pollicis brevis, passes to the base of the second phalanx of the thumb. Function flexes the distal phalanx of the thumb and also the wrist. So you may see this muscle in blue color on this picture, and also you may see the tendon. The flexor digitorum profundus muscle, musculus flexor digitorum profundus in Latin, originates from the ulna and the interosseous membrane. Its four tendons arising from the belly in the middle of the forearm passes through the canalis carpalis onto the palm under the tendons of the superficial flexor and then to all the fingers with the exception of the thumb. Each of these tendons enters the hiatus tendinous between the two parts of the tendon of the flexor digitorum superficial, crosses it and attaches to the distal phalanx. This muscle flexes distal phalanx and also assists to flexion of the wrist. And next we'll talk about pronator quadratus muscle. You may see on the picture. It's flat quadrangular muscle lying directly on both forearm bones and on the interosseous membrane immediately above the wrist joints. The fibers of the muscle rise on the palmar surface of the ulna, pass laterally and slightly downward and attach to the palmar surface of the radius. Action. This muscle is the main pronator of the forearm, while the pronator teres is an axillary pronator. And pronatio, I repeat this turning to the medial side. Next, we'll talk about posterior group, and you may read these muscles. The superficial layer of the posterior muscles can be divided in two subgroups, radial and ulnar. The first occupies the anterolateral surface of the arm, while the second occupies the posterior surface. So the radial group, brachioradialis muscle, musculus brachioradialis, it's in Latin. You may see in gray color this one above the blue muscle of this picture. In blue you may see the next muscle, musculus extensor carpiradialis longus. We will talk about this later. So, brachioradialis muscle, musculus brachioradialis, lies on the lateral border of the forearm. It arises from the lateral border of the humerus and the lateral intermuscular septum between the brachial and triceps muscles. Its expanding belly distance in front of the radius and the ends in the middle of the forearm in a long flat tendon which attach to the radius above the styloid process. Medially it borders upon the pronator teres and the flexor carpiradialis muscle. Action. Flexes the forearm at the elbow joint and sets the radius in position intermediate between pronation and supination. Next we'll talk about extensor. Extensor carpiradialis longus and brevis. You may see also brevis muscle or short extensor muscle. So first we'll talk about lung muscle. Musculus extensor carpiradialis longus, it's in Latin, is lateral and behind the brachioradialis muscle and originates from the lateral border and lateral epicondyle of humerus and from the lateral intermuscular septum. In the middle of the forearm, the muscle ends in tendon which passes on the lateral surface of the radius, then under the retinaculum extensorium, and attached to the dorsal surface of the base of second metacarpal bone. Action. Flexes the forearm and accomplishes dorsiflexion and radial abduction of the wrist joint. This action, abduction, is performed together with the flexor carpiradialis muscle. So next, the extensor carpiradialis brevis muscle, musculus extensor carpiradialis brevis, lies behind the lung radial extensor of the wrist and arises from the lateral epicondyle of the humerus and the capsule or elbow joint. Its tendon encompasses the tendon of the lung radial extensor of the wrist, both crossing the abductor pollicis longus and the extensor pollicis brevis muscles in the distal 1/3 of the forearm and the tendon of the extensor pollicis longus on the hand. They then pass through a common second fibrous canal under the retinaculum extensorium and the tendon of the extensor carpiradialis brevis attached to the dorsal surface of the base of the third metacarpal bone. Action. Flexes the forearm and extends or dorsal flexion and radial abduction of the wrist. Next we will talk about ulnar group or elbow group. So extensor digitorum muscle. All these three muscles which can you see on this picture are form superficial layer. The extensor digitorum muscle stretch on the posterior surface of the forearm. It arises with extensor capillaris brevis from the lateral epicondyle, from this place. So you can see this muscle. I point this muscle in pink color. So in the middle of the forearm, the muscle separates in two bellies, each ending in a long tendon. The tendon descends to the dorsal surface of the hand, you may see on this picture, passes under the retinaculum extensorium through the fourth canal, and then diverge towards the forefingers, with the exception of the tongue. On the dorsal surface of the hand near the metacarpophalangeal joint, the tendons are joined by means of oblique fibrous bands, intertendinous connection, connexus intertendinous. You may see particularly this connection here, with the result that the middle and ring fingers can be extended only jointly. The index finger and partly the little finger retain their independence because they have their own extensor. On the dorsal surface of each finger, each tendon of the common extensor forms a triangular tendinous expansion separating into three slips. A middle slip is attached to the base of the middle phalanx, and two collateral slips are attached to the base of the distal phalanx. Action: extend the index, middle, ring, and little fingers and accomplish dorsiflexion of the wrist. The extensor digiti minimi muscle, you may see this muscle here, I pointed. Musculus extensor digiti minimi, it's in Latin, branches off from the common extensor of the fingers on its ulnar side. Its long tendon passes through the fifth canal under the retinaculum extensorium, the dorsal surface of the hand, to the little finger and joins the tendon of the common extensor that reaches the finger. So function: extends little finger. And next we'll talk about extensor carpi ulnaris muscle. Musculus extensor carpi ulnaris, you may see this muscle in blue color, whose lateral border joins the common extensor and the extensor of little finger, arises with these muscles from the lateral epicondyle of the humerus and from the posterior border of the ulna. The tendon of the muscle passes through the sixth tendinous canal under the retinaculum extensorium and attached to the base of the fifth metacarpal bone, tuberositas ossis metacarpi quinti, it's in Latin. Action: accomplishes dorsal flexion of the wrist and adducts the wrist to the ulnar side. The last action is performed with the flexion carpi ulnaris muscle. So next we'll talk about deep layer. You may see and read the names of these muscles. So supinator muscle. You may see this muscle, I pointed on the right picture. Musculus supinator, it's in Latin, is a superior lateral part of the forearm. It's covered by the brachioradialis muscles and by both radial extensor of the wrist. The supinator muscle arises from the lateral epicondyle of the humerus the radial collateral ligament of the elbow joint at the upper end of the ulna. It embraces the proximal end of the radius above and below the radial tuberosity. The muscle is pure supinator of the forearm. So next we'll talk about abductor pollicis muscles. You may see abductor longus, and also you may see extensors muscles. Abductor pollicis muscle, longus muscle, musculus abductor pollicis longus, and extensor pollicis brevis muscle, both arise next to each other. The long muscle above the short from the posterior surface of the radius, the interosseous membrane, and partly from the ulna. So you may see these muscles, abductor pollicis muscle and extensor pollicis brevis muscle. Both these muscles you may see on the right picture. So lying together, they pass distally and laterally, emerge from under the radial border of the common extensor of the fingers, and pass through the first canal under the retinaculum extensorium to the thumb. The tendon of the abductor pollicis longus is attached partly to the base of the first metacarpal bone and partly to a tendinous slip of the abductor pollicis brevis, while the tendon of the extensor pollicis brevis is attached to the base of the proximal phalanx of the thumb. The abductor pollicis longus abducts the thumb and abducts the wrist radially. The extensor pollicis brevis extends the proximal phalanx of the thumb. So, the extensor pollicis longus muscle, musculus extensor pollicis longus, you may see this muscle here on this picture. And so, this muscle arises from the middle 1/3 of the posterior surface of the ulna, and the interosseous membrane emerges as a tendon from under the common extensor of the fingers below the preceding two muscles, crosses the tendons of both radial extensor of the wrist obliquely, passes under the retinaculum extensorium and the third canal, and then to the dorsal surface of the tongue, where it's attached to the base of the second phalanx, or distal phalanx. So, a hollow called the anatomical snap box forms the radial side of the wrist joint between the tendon of the extensor pollicis longus muscle and tendons of the extensor pollicis brevis at abductor pollicis longus muscles. So this place is called anatomical snuff box. And you may see this snuff box in yourself when you extend and abduct the pollex or tongue. So, next we'll talk about extensor indicis muscle. Extensor indicis muscle, musculus extensor indicis, arises from the distal 1/3 of the posterior surface of the ulna. Its tendon passes with the tendons of the common extensor of the layers through the fourth canal under the retinaculum extensorium. There it joins the outer side of the tendon of the common extensor passing to the index finger, and it continues with the dorsal tendinous expansion of the finger. The action extends the index finger. So you may see the channels behind the flexor retinaculums. You may see the tendinous part of flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus muscles. All these 9 tendons goes behind the flexor retinaculum. And also you can see that in laterally part passes the tendon of musculus flexor carpi radialis, flexor carpi radial muscle. And on this picture you may see the tunnels behind the extensor radial or extensor retinaculum. The bundles of connective tissue behind the extensor retinaculum form 6 channel. In first channel passes two tendons, the tendon of muscular extensor pollicis brevis and tendon musculus abductor pollicis longus. In second channel passes 2 tendons, tendon musculi extensor carpi radialis longus and tendon musculis extensoris carpi radialis brevis. In third channel passes musculus extensor pollicis longus, and you also can see the anatomical snap box here. So through fourth channel pass two muscles, the tendons of musculus extensor digitorum and tendon musculus extensor indicis. Through fifth channel pass the tendon of musculus extensor digiti minimi, and through sixth channel pass the tendon of musculus carpi extensor carpi ulnaris, musculus extensor carpi ulnaris. So also you may see the synovial vaginal flexor. You may see that the vaginal flexors of index, middle, and ring fingers are isolated. You may see this feature on this picture, and also you can see that the vagina synovial of little finger passes to the common vagina of vagina communis of musculus flexorum, and then it passes to the forearm. And also you may see that the vagina of tendons flexor thumb flexors passes to the forearm too. And this is very important to treat the phlegmons or abscesses of the wrist and hand. So next we'll talk about the muscles of hand. In addition to the tendons of the forearm muscles passing on the dorsal and palmar surfaces of the hand, there are short muscles of the hand proper which arise and are inserted to this part of the upper limb. 3 groups of these muscles can be distinguished. 2 of them located on the radial and ulnar border of the palm form the tenar eminence or tenar and hypotenar eminence. The third middle group is situated in the hollow of the hand, palmar manus, it's in Latin. The muscles of the human hand, which as the organ of labor is the most important part of the upper limb. As compared to the thumb of anthropoid apes, the muscles of the human thumb are so highly developed that the thumb is maximally opposable. The tip of the thumb can reach the joints of the little finger when there are fingers flexed in a fist. The extensor are also highly developed in men, and each finger can be fully extended. As a result, the hand and each finger are capable of maximum flexion and extension, which are necessary in work. So first we'll talk about tenor muscles of the radial eminence of the hand. There are four muscles. You may read the names. The abductor pollicis brevis muscle lies more superficially than the other muscles. Its fibers arise from the retinaculum flexorum and the tubercle of the scaphoid body and converge to the beachhead of the radial surface of the base of the proximal phalanx of the tongue. Action abducts the tongue at the carpometacarpal joint. The flexor pollicis brevis muscle. You may read and see these muscles on the picture too. It has two heads. The superficial head arises from the retinaculum flexorum, stretched along the ulnar border of the tenor, and then becomes narrower and attached to the radial sesamoid bone of the metacarpal phalangeal joint of the tongue. The deep head arises from the trapezium, trapezoid, and capitating bones and attaches primarily to the ulnar sesamoid bone and to the base of the proximal phalanx of the tongue, and by small slip to the radial sesamoid bone. The groove formed between the two heads transmits the tendon of the flexor pollicis longus. Flexes the proximal phalanx is the function, and it assists a position of the tongue. The opponens pollicis also, musculus opponens pollicis, lies along the radial border of the tenor under the abductor pollicis brevis. It arises from the retinaculum flexorum and the tubercle of the trapezium and attached to the radial border of the first metacarpal bone. The function is opposes the tongue by pulling its metacarpal bone to the palate. The adductor pollicis muscle, musculus adductor pollicis, lies deep in the palm. Its wide base arises from the palmar surface of the third metacarpal bone. The muscle, when passes in front of the second intermetacarpal space at the second metacarpal bone, narrows and attached to the ulnar sesamoid bone and to the base of the proximal phalanx of the tongue. Function adduction of the tongue and assist in apposition of the tongue. So next we'll talk about hypotenor muscles. So you may see four hypotenor muscles. First, the short palmar muscle, or musculus palmaris brevis, lies superficially under the skin. It arises from the ulnar border of the palmar epineurosis and from the flexor retinaculum and ends in the skin of the palmar border of the palm. It tenses the palmar epineurosis and forms little folder on the middle edge of hand. Next, we'll talk about abductor digiti minimi muscle. You may see the name and you may see part of this muscle on the picture. The abductor digiti minimi muscle stretches superficially on the outer border of the hypotenor. It arises from the flexor, retinaculum, and the pisiform bone, and inserted into the outer border of the base of the proximal phalanx of the little finger. Action is abduction of a little finger. Abduction. The flexor digiti minimi brevis muscle is situated on the radial border of the preceding muscle. It originates from the retinaculum flexorum and the hook of the hamate bone and attached to the base of the proximal phalanx of the little finger. So you may see this muscle part of muscle on these pictures and this one. So the function is flexes the proximal phalanx of little finger. And next we'll talk about appenans digiti minimi muscle. It's almost completely covered by the preceding two muscles. It arises from the flexor retinaculum and from the hook of hamate bone and attached to the outer border of the fifth metacarpal bone. So action, draw the little finger toward the thumb or apposition. You may see the apposition between little finger and thumb. So next we'll talk about muscles of the palmar cavity or hollow of the hand. So the lumbrical muscles, or musculi lumbricalis it's in Latin. So you can see these muscles here and also here. These muscles are four narrow muscular slips lodged between the tendons of the deep flexor of the fingers from which they arise. Two radial muscles originate from the radial border of the corresponding tendons, while two ulnar muscles arise from adjacent sides of the second, third, and fourth tendons of the deep flexor. Passing to the fingers, the lumbrical muscle curve around the heads of the metacarpal bones on the radial side and attach on the dorsal surface of the proximal phalanx to the tendinous expansor of the common extensor of the fingers. The muscles flex the proximal phalanx and extends the middle and distal phalanx of the index, middle ring, and little fingers. This movement. Two radial muscles are innervate broad branches of the medial nerve, and two ulnar muscles from the ulnar nerve. So, next we'll talk about interossal muscles. The palmar interossal muscles occupy the spaces between the metacarpal bones and are separated in two palmar and dorsal muscles. These muscles are adductor and abductor of the fingers in relation to the midline, and they are naturally grouped around the middle finger or third finger. Thus, the three palmar interossal muscles are adductor. You may see the movements. These three palmar muscles adduct index, ring, and minimus finger to third. The dorsal tendinous expansor of extensor digitorum on the index, ring, and little fingers. Four dorsal muscles are abductors. They converge toward the third metacarpal bone and attach to the index, middle, and ring fingers. So you may see the movements of the dorsal interossal muscles. One of them adduct the ring finger from middle. Next, abduct index finger from middle, and two muscles which attach to the radial and ulnar surfaces of proximal phalanx adduct the middle finger to the ring finger and adduct the middle finger to the index finger. So next I will talk about muscles of the lower limb. The muscles of the lower limb are divided into the muscles of the hip region, thigh, leg, and foot. There are no special muscles of the pelvic girdle because it's held stationary. The muscles of the lower limb are innervated by lumbar and sacral plexors. So first we'll talk about muscles of hip region. The muscles of the hip region of the hip pass from the pelvic girdle to the femur and allow the movement of the hip joint to each of its three axes. Arranged on all sides of the joint, the muscles perform every type of movement. They can be classified according to the location of their attachments to the femur and according to their principal action into anterior, posterior, and medial groups. The anterior group, are flexors, is attached to the lesser trochanter. It consists of the iliopsoas muscle, for example, the posterior group, extensor, rotators, and abductors are attached to the greater trochanter, or its vicinity. This group includes the following muscle: gluteus maximus, gluteus medius, tensor fascia lata, gluteus minimus, piriformis, pterygosaurus internus, gemmelli, and quadratus muscle. The medial group, adductors, attached to the linea aspera femoris. The only exception is gracilis, which attached on the leg, and consists of the following muscle: pectineus, adductor longus, adductor brevis, adductor magnus, and gracilis. The muscles of the medial group are functionally related to the hip joint, at which they accomplish abduction of the thigh, but their entire mass is located on the thigh. For the sake of the convenience, therefore, the medial group of hip muscles is classified topographically and described below as medial group of the thigh. We'll talk about this later. So first we'll talk about anterior group of the hip muscles. You may see iliopsoas muscle, and you may read this name, consists of two heads. The psoas major muscle, you may see this one, arises from the lateral surface of the body and intervertebral disc of the 12th thoracic and upper 4 lumbar vertebrae, and from the transverse process of the lumbar vertebra. Distending slightly laterally, it meets the iliacus muscle. You may see this muscle on the picture. The second head, the iliacus muscle, arises from the iliac fossa and from the superior and inferior anterior iliac spine. Medially, the iliac muscle is partly covered by the psoas muscle and a deep groove to transmit the femoral nerve. You may see this groove. The fibers of the iliac muscle converge as they pass downward and join the tendon of the greater psoas muscle to form a single iliopsoas muscle. This muscle lies on the anterior surface of the hip joint, emerges from under the inguinal ligament through the lacuna muscularum. You may see this lacuna here, and attached to the lesser trochanter. Between the muscle and the joint capsule is a small synovial bursa iliopectinea, which sometimes communicates with the joint. Action: accomplishes flexion at the hip joint by pulling the thigh to the abdomen and slightly rotating it medially. When the lower limb is steadied, the muscle causes forward flexion of the pelvis with the trunk. The psoas minor muscle, you may see this muscle here, adjoining the greater psoas muscle, is a constant muscle. It arises from the 12th thoracic and 1st lumbar vertebra. Its long tendon blends with the iliac fascia and is inserted in the two iliopubic eminence. It tends the iliac fascia and may flex the lumbar segment of the spine. So next we'll talk about posterior group, the gluteus maximus, gluteus minimus, medius muscles. Gluteus maximus is a massive muscular layer lying directly under the skin and fascia in the region of the buttock. It arises from external lateral surface of the ilium bone, from the lateral parts of the sacrum and coccyx, and from the sacrotuberal ligament, and distends obliquely and laterally as parallel muscular bundles separated by a thin septa rising from the fascia covering the muscle. The interior muscular bundles end in the wide flat tendon, which curves around the lateral surface of the greater trochanter and continues with the fascia lata femoris. The posterior part of the muscle is attached to the gluteal tuberosity of the femur. You may see this muscle here, and also you may see the trochanter tertius here. Or gluteal tuberosity. Synovial boson is lodged between the tendon of the muscle and greater trochanter. Here. The action. This is antagonist of the iliopsoas muscle, extends the thigh, rotating it slightly laterally or supinating. When the lower limbs are held fast, it extends the anteriorly flexed trunk. When the body is upright and the pull of gravity affects the front of the transverse axis of the hip joints, as typical of military carriage, tension of this muscle maintains the balance of the pelvis and the body and prevents the torsiform falling forward. The gluteus medius muscle. You may see this muscle here, it's scattered, and also here, is covered posteriorly by the gluteus maximus muscle. Its anterior part lies near the surface. This muscle arises from the exterior surface of the ilium as a fan-shaped belly and ends in a flat tendon attached to the lateral surface of the greater trochanter, close to the apex. Action. When contracted, this muscle abducts the thigh. Separate contraction of the anterior bundles rotates the thigh medially, while contraction of the posterior bundles rotates it laterally. When the body is supported on a single lower limb, the muscle shifts the pelvis to one side. The tensor fascia lata muscle, musculus tensor fasciae latae, you may see it here on this picture, developed in the embryo separately from the gluteus medius muscle. It lies directly in front of the gluteus medius muscle of the lateral surface of the thigh between the two layers of the fascia lata. The muscle arises from the superior anterior iliac spine, where it blends with the initial part of the middle gluteal muscle, and it continues distally with the thickest band of the fascia lata called the iliotibial tract. This band stretches along the lateral surface of the thigh and attached to the lateral tibial condyle. It tends the iliotibial tract, and through it acts on the knee joint and flexes the thigh. Because of their connection with the tensor fascia lata, the maximus and medius gluteus muscles contribute to movement at the knee joint by assisting flexion and lateral rotation, such supination. Next, we'll talk about gluteus minimus muscle. You may see this on this picture. lies under the gluteus medius muscle. It arises from external surface of the ilium and attached to the anterior surface of the greater trochanter by a flat tendon. A bursa is lodged under the tendon and between tendon and trochanter mya. Action of this muscle is the same like middle gluteal muscle, and you know that this muscle abducts the thigh and rotates laterally. Next, we will talk about piriform muscle, musculus piriformis. You may read, and also we'll talk about obturator internus and gemmellis muscles. So let's talk about piriform muscle. You may see this muscle on the picture. This muscle arises on the pelvic surface of the sacrum bone, lateral to the anterior sacral foramina. It leaves the pelvic cavity through the greater ischiadic foramen, passes transversely on the posterior surface of the hip joint, and attached to the greater trochanter. The muscle does not fill the greater ischiadic foramen completely but leaves slits on its superior and inferior edge for transmitting vessels and nerves. Action rotates the thigh laterally and assists to its abduction. Next, we'll talk about obturator internus muscle. You may see this muscle here. This muscle originates on the inner surface of the hip bone from the margin of the obturator foramen, and the obturator membrane passes over the bone edge of the lesser ischiadic foramen and attached to the trochanteric fossa on the femur. A synovial bursa is lodged under the muscle where it curves over the bone, here. The edge of the internal obturator tendon lying outside the pelvic cavity on the posterior surface of the hip joint are fused with two flat and narrow muscles which called gemellus muscle. You may see superior and inferior gemellus muscle. Gemellus is in Latin twins. Like twins, yes? Superior and inferior twins. This superior muscle arises on the ischial spine, the inferior muscle on the ischial tuberosity. Both these small muscles, together with the tendon of the tendinopterator muscle, are attached in the trochanteric fossa and are covered by the gluteus maximus muscle. Action rotates the thigh laterally, or supination. And next we'll talk about quadratus femori muscle. You may see catch this muscle is cutting here. You may see the only parts, proximal and distal part of this muscle. The quadratus femoris muscle lies inferior to the inferior gemellus muscle under the lower bundle of the gluteus muscle or gluteus maximus muscle. Its fibers run transversely from the ischial tuberosity to the intertrochanteric crest of the femur. Function rotates laterally, or supination. And next we'll talk some words about obturator externus muscle. You may see the muscle here. It arises from the external surface of the pelvic bones along the medial margin of the obturator foramen and from the obturator membrane, passes around the capsule of the joint, hip joint, from below and from the back, and attached by a narrow tendon to the trochanteric fossa and to the joint capsule. So it also rotates thigh laterally. You may see this muscle again, and also you may see forming over piriform foramen and under piriform foramens. Through these foramens passes vessels and nerves. Next, we will talk about muscles of free lower limb. And first we'll talk about thigh muscle. You may read all these muscles here on this page. The muscles of the thigh help men walk erect and maintain an erect position by movement of the long bone levers. These long muscles fuse to form strong masses with a single common tendon and more than one head. The muscles of the thigh are divided into three groups, and you may see these three groups: anterior or front, back or posterior, and medial group. So, the muscles of anterior group, mainly extensor of knee joint, posterior group, mainly flexors of knee joint, and medial group are adductors. The last group acts only on the hip joint, whereas the first two groups also act on knee joint, as I told you, by producing movements predominantly on its frontal axis. This is possible because of their position on the anterior and posterior surfaces of the thigh and attachment to the leg. Laterally, the anterior and posterior group of muscles are separated by a lateral intermuscular septum of the femoral fascia, which is attached to the lateral lip of linea aspera. Medially, a layer of adductor muscles is wedged between them. So let's in details talk about front group, the anterior group. So quadriceps muscle, you may see this muscle in the picture, occupies the entire interior and part of the lateral surface of the thigh and is formed of three heads fused to each other. These heads are as follows. The rectus femoris muscle lies superficially and arise from the inferior anterior iliac spine and form the superior margin of the acetabulum. You may see this rectum muscle here. At its origin, it's covered by the tensor fascia lata and by sartorius. The rectus femoris muscle passes on the middle of the thigh and joins the common tendon of the whole quadriceps muscle above the patella. The vastus lateralis muscle, musculus vastus lateralis, encircles the femur laterally and arises from the intertrochanteric line, from the lateral surface of the greater trochanter, and from the lateral lip of the linea aspera femoris. The fibers of the muscle distend obliquely and end some distance above the patella. The vastus medial muscle, musculus vastus medialis, lies medially in relation to the femur. It arises from the medial lip of the linea aspera femoris. Its fibers pass obliquely from the medial side laterally and downwards. You may see on this picture. The vastus intermedius muscle, musculus vastus intermedius, lies directly on the anterior surface of the femur, from which it takes its origin, almost reaching the intertrochanteric line proximally, and its fibers stretch vertically, parallel toward the common tendon. Laterally and medially, vastus intermedius muscle is covered by the lateral and medial great muscles, with which it blends here. The rectus femoris muscle is in front of it. Under the knee joint, these parts of quadriceps muscle form a common tendon which is attached to the base and sides of the patella, and it then continues with the patellar ligament attached to the tibial tuberosity. You may see this ligament here, this tendon. Um, some of tendon fibers of the vastus lateralis and vastus medialis pass on the sides of the patella downward and obliquely to form the retinaculum of patella. Mentioned in the section of the syndesmology, and we talked about these ligaments in arthrosyndesmology lecture. The patella the patella is inflamed in a tendon of quadratus muscle, increase the angle at which the muscle meets the lever, which favorably influences the application of its force. So action flexes the leg and at the knee joint, uh, the rectus femoris flexes the hip joint, uh, and as it passes over it. Um, but rightly, if we talk about function, this is extension of knee joint, extension of the leg in knee joint. Next, we'll talk about sartorius muscle. You may see this muscle in the picture. Arising from the superior anterior iliac spine, this muscle distends medially as a long band of parallel fibers and is attached to the fascia of the leg and the tibial tuberosity. Flexes the knee joint, and when the knee is flexed, rotates the leg medially. Next, we'll talk about posterior group. You may see the name of these muscles. Semitendinous muscle is called so because its long tendon, which makes up almost the entire distal half of the muscle, it arises on the ischial tuberosity and attached behind the gracilis muscle to the tibial tuberosity and the fascia of the leg. At the site of the attachment, the tendon of the semitendinous muscle, together with the tendons of the gracilis and sartorius muscles, from the triangular tendinous extension continues with the fascia of the leg. This extension is called the superficial goose foot or pes anserinus superficialis, under which a synovial bursa is lodged. Semimembranous muscle, you may see semitendinous muscle, and also you may see semimembranous muscles, lies under the semitendinous muscle. It arises on the ischial tuberosity as a flat tendon which distends and forms almost the entire proximal half of the muscle. The end tendon separates at the site of attachment into three bands, the pes anserinus profundus, one of which is attached to the medial condyle of the tibia, another attached to the fascia covering the popliteus muscle, and the third falls over the posterior wall of the knee joint and is continuous with the oblique popliteal ligament. The biceps muscle, you may see this muscle on the picture, this one. The biceps femoris muscle is located near the lateral border of the thigh and is separated from the vastus lateralis by the lateral intramuscular septum. The muscle consists of two heads, and named biceps. The long head, caput longum, arises with the semitendinous muscle from ischial tuberosity, and the short head, caput brevis in Latin, arises from the middle one-third of the lateral lip of the linea aspera femoris and the lateral intramuscular septum of the thigh. The heads fuse and attach into the head of the fibula. And also we talk about popliteus muscle, musculus popliteus. It's triangular and lies on the posterior surface of knee joint. It arises from the lateral epicondyle of the femur and from the capsule of the knee joint, oblique popliteal ligament, and also insert into the proximal part of the posterior surface of the tibia. Since the semitendinous, semimembranous, and biceps femoris muscles stretch over two joints, Their simultaneous action flexes the leg at the knee joint, extends the thigh when the pelvis is steadied, and assists the gluteus maximus muscle in extension of the trunk when the leg is steadied. When the knee is flexed, this muscle rotates the leg, contracting separately on either side. The leg is rotated laterally by the biceps muscle and medially by the semitendinous and semimembranous muscles. The popliteus muscle acts only the knee joint and flexes the knee and rotates the leg medially. Next, we'll talk about medial group. The pectineus muscle. You may see this muscle on this picture. Originates from the superior ramus and crest of the pubis and from the superior pubic ligament, passes downward and slightly to the side and attaches to the pectineal line of the femur. Its lateral border joins the iliopsoas muscle. Where these muscles converge, they form the iliopectineal fossa, lodging the femoral vessel, and there exit from the pelvis. And next we'll talk about adductors muscle. You may see three adductors, longus, brevis, and magnus. The adductor longus muscle originates on the anterior surface of the superior ramus of pubic bone and attached to the medial lip of linea aspera femoris in its middle third. Its fibers, like the fibers of the other adductors, extend downwards and laterally. The adductor brevis muscle lies under the preceding muscles. It arises on the anterior surface of the pubis attached to the medial lip of the linea aspera on its upper part. The adductor magnus muscle is the strongest of the adductor group. It's farthest of the back and its proximal part is covered in front by the long and short adductors muscles. The adductor magnus arises from the rami of pubic and ischial bones and from the ischial tuberosity, passes laterally and attached to the medial lip of the linea aspera for its entire distance up to the medial condyle of the femur. The upper fibers of the muscle stretch almost transversely from the pubic bone to the site of their attachment and are classified separately as adductor minimus muscle. The lower fibers and the medial border of the muscle stretch almost vertically and end a strong tendon attached to the medial epicondyle of femur. The edge of this tendon is tightly stretched and can be easily palpated through the skin as the lower 1/3 of the thigh. And at last, we'll talk about gracilis muscle. Gracilis muscle is a long, narrow band of muscle passing superficially. You may see this muscle here on this picture. On the middle border of the adductor group. Its origin is one of the inferior ramus of the pubic bone close to the symphysis. The muscle is attached to the fascia of the leg and the tibial tuberosity. Action. As their names indicate, all the adductor muscles adduct the thigh, slightly rotating it laterally. Those lying closer to the front and crossing the transverse axis of the hip joint, the pectineus muscle, and the longus and brevis adductors can also accomplish flexion of this joint. The gracilis muscle passing over two joints, in addition to adduction of the thigh, flexes the leg at the knee joint and rotates it medially or pronates. So next we'll talk about some topographic elements. You may see on this picture, on the left picture, iliopsoatic muscle, and you also can see that it goes through a muscular lacume, and medially you can see the vessel lacume. You may see that femoral artery and vein passes through this lacume. And also you may see the thickest fascia of femoris and femoral hernia too. Uh, it's pathologic process um, in femoral region. Also, you can see adductor canal. It has three walls, um, and you may see that it passes vessels and nerves through it. So you can see middle wall, it's lamina vasta adductoria. Also, you can see the posterior wall. This is adductor magnus muscle, and also you can see the lateral wall. This is vastus medialis or quadriceps muscle. Okay, and next we'll talk about leg muscles. And so the muscles of the leg move the distal part of the limb, the foot. And like the muscles of the feet are adapted to moving and supporting the body in an upright position. The individual muscles, therefore, are not highly specialized when compared with the muscles of the forearm, which specialize as a result of the function of the hand like organ of labor. On the contrary, large masses of muscle in the leg, which fuse and have common tendons, combine their efforts to make the strong, wide movements necessary in walking erect. To facilitate movement on the frontal axis of the ankle joint and the finger joints, most muscles are arranged on the anterior and posterior surfaces of the leg between the tibia and fibula in front and in back. To facilitate movement of the foot on the sagittal axis, the muscles are also arranged on the lateral surface along the fibula, lateral muscles. The anterior and lateral groups are developmentally related to the dorsal muscles of the lower limb. The posterior is related to the ventral muscle. The posterior group is better developed than the other groups and consists of two layers, superficial and deep. So first we'll talk about anterior group. You may see there are three muscles, and also you can see these muscles on the picture. The tibial anterior muscle lies medially to all the other muscles and the strongest in this group. It arises on the lateral condyle and the proximal two-thirds of the lateral surface of the tibia and from the interosseous membrane and the crural fascia. It descends on the tibia and ends in a strong tendon passing through the medial fibrous canal under the retinaculum of the superior and inferior extensor to the medial border of the dorsal surface of the foot, where it is attached to the medial cuneiform bone and the base of the first metatarsal bone. Accomplishes dorsiflexion of the foot and arises its medial border or supination. When the foot is stationary, the muscle bends the leg forward, bringing it closer to the dorsal surface of the foot. Next, we'll talk about extensor digitorum muscle. The extensor digitorum longus muscle originates from the lateral tibial condyle, from the head and anterior surface of the fibula, from the interosseous membrane, and from the crural fascia. It descends the end in a tendon which separates into four parts, extending through the lateral canal in the retinaculum of the superior and inferior extensor of the dorsal surface of the foot. They diverge in the shape of a fan and attach to the tendinous expansion of the dorsal surface of the lateral four toes. A small slip of muscle arising from the lateral side of the distal part of the long extensor ends in the fifth tendon, which passes under the inferior extensor retinaculum and attached to the base of the fifth metatarsal bone. This is peroneus tertius muscle. It's considered the first stage of the separation of muscle new to man. It's absent in the apes. The pronator of foot that is necessary for walking on two limbs. Together with the peroneus tertius muscle, the extensor longus muscle accomplishes dorsal flexion of foot, raises the lateral border, pronation, and everts the foot. When the foot is stationary, the muscle acts similarly to the anterior tibial muscle. It also extends the lateral foretoes, although this action is slight. The extensor hallucis longus muscle lies deeper. You may see this muscle here on the picture. Lies deeper in the space between the two muscles described above. It arises from the medial surface of the fibula and from the interosseous membrane, descends through the medial canal under the inferior extensor retinaculum onto the dorsal surface of the foot, onto the great toe. It's attached to the distal phalanx of the great toe and also gives off a slip to the proximal phalanx. Action accomplishes dorsal flexion of the foot, raises its medial border or supination, and extends the great toe. When the foot is stationary, it assists the other anterior muscles in bending the leg forward. Next, we'll talk about muscles of lateral group, and you may see two of these muscles on this picture. This is peroneus longus and peroneus brevis muscles. So, peroneus longus muscle lies superficially and arises from the head and proximal one-third of the lateral surface of the fibula and from the anterior and posterior muscular septa and the crural fascia. The tendon passes laterally and then behind the short peroneal muscle, and together with it curves around the lateral malleolus posteriorly and inferiorly lying in a synovial sheath under the superior peroneal retinaculum. It then passes in a groove on the lateral surface of the calcaneus and is retained of the bone by the inferior peroneal retinaculum. Further, it bends around the lateral border of the foot, fits under in it a groove on the cuboid bone, where it's invested a synovial sheath, crosses the sole of the foot obliquely, and it's attached on its medial border of the medial cuneiform and first metatarsal bone. The attachment to the medial cuneiform bone is inherent only in man, but not in apes, which reflects the tendency of the musculature on the back and foot to migrate to the tibial side and maintain the transverse arch of the foot. The peroneus brevis muscle lies under the long peroneal muscle. It arises from the middle third of the lateral surface of the fibula and from both intermuscular septa. Its tendon passes behind the lateral malleolus in the sheath shared with the long peroneal muscle, extends under the superior peroneal retinaculum and then under the inferior peroneal retinaculum, and it's attached to the tuberosity of the fifth metatarsal bone. It sometimes gives off a thin slip to the tendon of the extensor of the fifth toe. Action. Both peroneal muscles pronate the foot, lowering its medial and raising its lateral borders. They also abduct the foot and assist to the other muscles in its plantar flexion. And last, we'll talk about posterior group. I told you that they divided in two layers. First, we'll talk about superficial layer. The triceps surae muscle, musculus triceps surae is Latin, forms the main bulk of the calf. It's made up of two muscles. Musculus gastrocnemius, you may see this muscle, lying superficially, and musculus soleus, deeply under it. Both muscles have a tendon in common distally. The gastrocnemius muscle arises from the popliteal surface of the femur above both condyles by two heads whose tendons blend at their origin with the capsule of the knee joint, uniting on the midline both heads of the muscle and almost at the middle of the crus in a tendon which fuse with the tendon of the soleus muscle to form the massive calcaneal Achilles tendon. The soleus muscle is thick and fleshy. It lies under the gastrocnemius muscle and its origin occupies a great length of the leg bones. The line of its origin is one of the head and on the upper third of the posterior surface of the fibula and distance of the tibia almost to the borderline between the middle and lower third of the leg. Where the muscle crosses from the fibula to tibia, the tendinous arch of the soleus muscle forms, under which the popliteal artery and tibial nerves pass. So, the plantaris muscle, you may see this muscle here, originate from the popliteal surface of the femur above the lateral condyle and from the capsule of knee joint. The short and narrow belly of this muscle soon ends in a very long and slender tendon. You may see this tendon here, stretching in front of the gastrocnemius muscle to the medial margin of the calcaneal tendon, where it attached to the calcaneal tubule. This muscle is undergoing reduction and is a rudimentary structure in man and may therefore be absent. So the musculature of triceps surae muscles accomplishes plantar flexion at the ankle joint both when the limb is free and when a person supports himself on the tip of the foot. Since the line of traction of the muscle passes medially of the axis and the subtalar joint, triceps surae also adducts and supinates the foot. In an erect position, triceps surae prevents the body from toppling over forward at the ankle joint. The muscle acts mostly under the weight of the whole body and is therefore distinguished by a force and large physiological diameter. The deep layer is separated from the superficial layer by the deep fascia of the leg. So the deep muscles of the leg you may see here. The flexor digitorum longus muscle is the extreme medial muscle of the deep layer. You may see here. It lies on the posterior surface of the tibia and arises from it and forms the deep fascia of the leg. Distance behind the medial malleolus and under retinaculum of the muscular flexorum and in the middle of the sole separates into four secondary tendons, which passes to lateral four toes with the tendon of the flexor digitorum brevis. Action. The muscle is of small importance as a flexor of toes. It mainly acts on the foot as a whole and accomplishes its plantar flexion and supination when the limb is free. Together with the triceps surae, it sets the foot on the tips of toes. In standing, the muscle assistively in strengthening the longitudinal arch of the foot. It presses the toes to the ground in walking. The tibial posterior muscle occupies the space between the leg bones and is situated on the interosseous membrane and partly on the tibia and fibula. It originates from these sides. Its tendon is closest to the margin of the medial malleolus and lodged behind it in a bone groove under the flexor retinaculum. The tendon there emerges onto the sole to be attached to the tuberosity of the navicular bone and then by several bounds to the three cuneiform bones and the bases of the second, third, and fourth metatarsal bones. It adducts the foot and also accomplishes plantar flexion like the other posterior muscle, together with the other muscle also attached to the medial border of the foot. The tibial posterior muscle forms a stirrup as a wear that strengthens the arch of the foot. Its tendons stretch through the calcaneonavicular ligament, as a result of which the muscle together with the ligament support the head of the talus. So the flexor hallucis longus muscle is the extreme lateral muscle of the deep leg. It lies on the posterior surface of the fibula, from which it arises, as well as form in the interosseous membrane and the posterior intimuscular septum. Its tendon passes in the groove of the posterior process of the talus, where it is covered by a layer of the flexor retinaculum, and then passes under the sustentaculum of the talus at the great toe and attached to the great toe distal phalanx. Action flexes the great toe due its possible connection with the tendon of the flexor digitorum longus. It may also flex the second and even the third and fourth toes. Like the other posterior muscles of the leg, the flexor digitorum muscle accomplishes plantar flexion, adduction, and supination of the foot and strengthens the arch of the foot in an anteposterior direction. So on this picture you may see some topographical elements. You may see popliteal fossa, rhomb-shaped popliteal fossa. It has merged borders laterally and superiorly biceps femoral muscle, medially semitendinous and semimembranous muscles, and low borders you may see two heads of gastrocnemial muscles. So next we will talk about muscles of the foot. The foot, like the hand, in addition to tendons of the long muscles of the leg descending on it, has its own short muscles, among which dorsal and plantar muscles are distinguished. And I repeat that there are no own dorsal muscles on the hand, but there are dorsal own muscles on the foot. You may see there are two muscles. Extensor digitorum brevis muscle lies on the dorsal surface of the foot under the extensor digitorum longus tendons. It originates on the superior lateral surface of the calcaneus just before the entrance into the sinus tarsi, extends forward and divides into four thin tendons. These tendons stretch to the middle four toes and fuse with the lateral margin of the extensor digitorum longus and extensor hallucis longus tendons, with which they form the dorsal tendinous expansion of the toes. Action extends the middle four toes so extends the hallucis brevis muscle, extends the great toe. And next we will talk about plantar muscles. You may see three group of these muscles. The medial group consists of three muscles. The abductor hallucis muscle is closest to the surface of the medial border of the sole. The strong muscle arises from the medial process of the tuberosity of the calcaneus, the retinaculum of the flexor muscles, and the tuberosity of the navicular bone, and is attached to the medial sesamoid bone at the base of the proximal phalanx. You may see this muscle here. The flexor hallucis brevis muscle adjoins the lateral border of the above described muscle, abductor hallucis. It arises from the middle cuneiform bone at the plantar calcaneocuboid ligament, passes straight to the front, separating into two heads between which the tendon of the flexor hallucis longus muscle passes. Both heads are attached to the sesamoid bones of the first metatarsophalangeal joint and to the base of the proximal phalanx of the grid 2. The adductor hallucis muscle, you may see this muscle here, lies deeply and consists of two heads. One of the heads, this oblique head, caput obliquum, arises from the cuboid bone, the long plantar ligament, the lateral cuneiform bone, and the basis of the second, third, fourth metatarsal bones, and passes obliquely to the front and somewhat medially. The other head, transverse, originates from the inferior surface of the capsules of the four lateral metatarsophalangeal joint at plantar ligaments. It passes transversely to the sole and together with the oblique head is attached to the lateral sesamoid bone of the grade 2. Action. In addition to the action indicated by their name, the muscles of the middle plantar group contribute to strengthen the arch of the foot of the middle side. Next, we'll talk about lateral group. You may see abductor digiti minimi muscle, flexor digiti minimi muscle, and also you will see these muscles here. The abductor digiti minimi muscle lies on the lateral border of the sole closer to the surface than the other muscles. It arises from the inferior surface of the calcaneus at the plantar aponeurosis and attached to the base of the proximal phalanx of the little toe. The flexor digiti minimi muscle arises from the base of the fifth metatarsal bone, and the long plantar ligament, and attached to the base of the proximal phalanx of little toe. Next, we'll talk about muscles of middle group. The flexor digitorum brevis muscle lies superficially under the plantar aponeurosis. It arises from the tuberosity of the calcaneus, and the proximal part of the plantar aponeurosis stretches straight to the front and divides into four slender tendons attached to the middle phalanx of the four lateral toes. Before attachment, each tendon separates in two limbs between which the long flexor tendon passes. The muscle houses fast longitudinal arch of the foot and accomplishes plantar flexion of the four lateral toes. The flexor digitorum accessorius muscle, you may see this muscle here on this picture, deeper. Oh, sorry. Here. This muscle lies under the short flexure of toes, arises from the calcaneus, and joins the lateral border of the long flexor tendon. You may see the long flexor tendon here. This bundle regulates the action of the long flexor of the toes, lending its direction a straight direction in relation to the toes. The lumbrical muscles are four in number, similar to the lumbrical muscles of the hand. They arise from the middle borders of the four long flexor tendons. The three lateral muscles also originate from the opposing borders of the tendons. They attach to the medial margin of the proximal phalanges of the four lateral toes and do not always reach the dorsal tendinous extension. These muscles may flex the proximal phalanges while the extensor action of our phalanges is very weak or absent. They can also pull the four lateral toes towards the great toe. The dorsal interosseous muscle are the deepest muscle of the sole and lie in the spaces between the metatarsal bones. Like the interosseous muscle on the hand, they separate in two groups, three plantar muscles and four dorsal muscles. Um, three plantar muscles adduct third, fourth, and little toe to the second toe, and four dorsal interosseous muscles abduct fourth and third toes from second, and adduct second toes to hallux or to great toe and to the third toe. So the lesson is over, lecture is over. I wish you all the best. Bye bye. Thank you very much for your attention.